Hi everyone, I'm Patty LaMonaco and I'm your Practice Development Director, and I know that I've met with many of you and talked with many of you. And today I am here with a very important member of our Lifescape team, Dana Bosselman, and she is our functionally trained registered dietitian. And one of the reasons that we're here today is to talk about the continuing education of all of our providers and how really important and meaningful that is to our patients. We know at Lifescape that our patients are not just a list of medications and medical problems, but they are whole people, and that's how we like to make sure that we're taking good care of them. Our providers treat each patient as that whole individual, and Lifescape providers will do everything they can to really advance the wellness and vitality of each individual. Part of that is continuing their own education by really knowing what's latest and greatest and most important in the medical advancements that are out there, and especially at this time in the world. And also to continue their own individual education in things that are really going to benefit our patients. So this is an absolute value that our providers offer to all of our patients. I am here on this note. We have a very exciting announcement that adds even more value, and that's that Dana has just completed training with the Kressner Institute and has become a train adapt provider. And so we're going to talk a little bit about that today and what that means to you as a Lifescape patient. So Dana, what is ADAPT? What is an ADAPT provider, and what motivated you to become an ADAPT provider?
Okay, that's a lot of questions right there, but I'm happy to answer them all. Thank you, Patty, for the great introduction. And thank you all for taking some time to listen today to what this means. So the Kressner Institute is international, and it's very well recognized and an esteemed education outlet. And they train providers and also health coaches. So there's two different tracks that you can sign up for, and each is completely separate. They're both year-long commitments. So it's not something you take lightly. And I signed up for the provider track because that's the level of care that I wanted to provide and to advance myself on. And what the Kressner Institute does is they train the provider with what we call the boots on the ground sort of training, meaning that you're not just theoretical or academic. You are to some extent, but the understanding is that you've already had that training, you've already had the academic rigor, and what you're looking for is real world clinical skills and protocols and vetted information that you can just take as is and use. So it's an immediate action plan, and it's a way to train providers to become more skilled in the functional medicine model of care.
It was my understanding that you are one of very few registered dietitians that have graduated from Kressner as a provider. Is that correct?
Yes, as far as I know, usually this program attracts medical doctors, DOs, which are also medical doctors, PAs, nurse practitioners, chiropractors, and dietitians are allowed to be in the program, of course, but it's just not something commonly done because it's really, if I didn't have all the training I already did going into the program, it would have been overwhelming. And so that leads me to answer your next question, which is, well, why did I do it?
Right.
I did it because I had a level of training that was helping people beyond the scope of my basic dietitian training, but I was in that middle space where I knew more, but I knew enough to know I didn't know enough. And so I wanted to take that to the next, even a higher level. And I wanted to be able to bring even more benefit to my patients and have even better suggestions and vetted protocols and confident in supplement regimes and improved handouts that made everything more seamless. So I really did it because for me, if I'm not offering the highest level of care, then it's not good enough.
Dana, We are so lucky to have you, because this is something that you did on your own. It's not something that Lifescape required. I mean, as far as, that's what's so wonderful about the team here, is that everybody is really motivated to make a difference in patients' lives, and they do that on their own. And I think that's why, we have attracted so many wonderful patients also that really get what's important in life. So how do you think your training is going to improve? Like when you have your consultation with our patients, what do you think? You think you'll do things differently? What will the ADAPT training do for our patients?
Yeah, absolutely. As I was going through the program from day one, every time I'd finish a lesson or a module, it would be amazing because I would have a patient come in that had that exact need.
Wow, yeah.
It was just like a universal coming together.
Uh-huh.
And so I would immediately take that information and use it with the patient. So there's nothing better than learning something and then applying it in a real world setting that just cements it in.
So
and make
wonderful.
sure, did you really understand that properly? Is there more research you need to do? The patient's working with you in relationship. And so that continued throughout the length of the course. And so now as the course is over and I have all the information and big picture, what I do differently is I do even more what I call deep dive.
Mm-hmm.
I am so focused on finding out why something is going on and treating that, and then offering that collaboration with the other providers and giving even more suggestions. As Dr. Wilder said to me the other day, she said, friendly nudges.
That's great. That's so we all need that. We all need that person in our corner that not only is going to support us, but really has the knowledge that's going to make a difference. I know you've made a difference for me, Dana. I mean, you absolutely have. Just tweaked a few things in my diet, put me on the right supplements, and I feel like a new person, just so much better. And I am so grateful to you. And I want to make sure that all of our Lifescape patients know that they have, as part of a benefit to their program, visits with Dana. You absolutely owe it to yourself to take advantage of those wonderful benefits that you have. And I mean, you can call the front desk, you can reach out to me, you can personally reach out to Dana, just call into the office, so that you have an opportunity. I think sometimes people don't know that there are solutions to things, and is that correct?
Yeah.
And they feel like they have to live with it. And then, that's what I was thinking for my own issues. And you were like, you don't have to live with this.
No.
You don't have to live with this. This is now you're all wondering what was that.
Yeah.
Right? But, just your normal gut health issues that we think, gosh, I'll just live with it. I just will avoid those foods. I'll just, and, you can make such a difference. So, you give hope and you make people feel so much better. And now with this new ADAPT training, we're so excited. That you can roll that out for our patients. So
thank you.
yeah.
Thank you
Anything
so
else
much.
you can add for us, Dana?
I just like everybody to know, I really want to build on and close with what you just said, which is we get used to what we are dealt with in life, and we think it's normal, but it's not. Or we think I'm getting older.
Right.
It's part of the aging process.
And it's not.
And it's not.
We don't have to live with those
some
things.
stuff
Right.
is to a certain
Right.
degree. Like,
Right.
yes, you may get a little more tired out, or you may not remember as many things as you
Right.
want to in a day.
Right.
But there's ways to enhance that. And
Right.
so until you really investigate and find out, is my normal actually normal, or is it just what I've settled for?
Mm-hmm.
So that's what we try to do here, is help you. I always say I want to move people from surviving to thriving.
Right.
So that's what I would close
Fabulous.
with.
Oh, that's so wonderful. Well, thank you so much, Dana.
Thank you, Kathy.
Okay.
Thank you, everyone.
Bye, everyone.
Bye for now.